What's really interesting about this concept of blood pressure medications being too strong is usually with my doctor colleagues and my medical students and stuff like that, we don't usually, I don't often at least, have conversations where the language is too strong comes up. We may say that the dosage is too high or it's causing side effects, etc. But, it's interesting. I've had some patients that have come in to me and have said, Dr. Caudle, I think my blood pressure medication is too strong. And I said, well, what makes you think that way? And many times in the office, when my patients have said this, they have referred to symptoms or side effects that they've been feeling. They say, well, it makes me feel this way, or I've felt this way since I started taking the medications. I think it's too strong. So what I first want to do, and this is my opinion, is sort of level set. When we talk about blood pressure medications being too strong, as a physician, when I think about the phrase too strong in the true sense of the word, what I think about is it works too well for the patient, meaning it may lower the blood pressure too much. Now, lowering the blood pressure too much is a problem, and that's generally how I think about, a medication being too strong. But I think many people also, when they're asking, hey, how do I know if my blood pressure medications are too strong? They're actually asking also about side effects or symptoms that you're feeling. So I want to sort of divide those up, talk about them separately, and give you some ideas about how to think about this, okay? So it does happen where we give blood pressure medications and the dose is too high. When the dose is too high, and perhaps for some this is sort of translated into it's too strong, it can cause your blood pressure to go too low, and that is a problem. Okay, if your blood pressure goes too low, it can cause symptoms. It can cause you to feel faint. It can cause you to feel lightheaded. It can cause you, if it's really low, to feel confused. Some people get like sweats or palpitation or just feeling like, oh, I don't feel so well, I need to sit down. They may feel fatigued, dizziness, and actually low blood pressure, if it's way too low, can be a medical emergency. So one way that I think about it is your blood pressure medication doses too high, which is causing your blood pressure to go too low? That is one, I think, important element that when you are asking, is my blood pressure medications too strong? One thing I would ask is, do you mean is your dose too high? Is your blood pressure going too low because the dose is too high? Now, the way to know, first of all, I would say is you need to involve your doctor. If your concern is that your blood pressure medication dose is too high, because of maybe symptoms that you're feeling, like the ones I mentioned or others, that you think your blood pressure is going too low, first thing you need to do is you got to call your doctor. And if you can't reach your doctor and you've got real concerns, you need to go to urgent care or the emergency room. Low blood pressure can be really potentially dangerous, okay? And I always have to say this because it's always better to be safe than sorry. You always want to make sure you know what's what. But let's say you don't have any urgent concerns, but you're suspicious or you're wondering. Well, one way to tell would be to get a blood pressure cuff. Maybe you have a home blood pressure cuff. Check your blood pressure at home. I always say when you go into your doctor's office and you're talking about blood pressure, bring in your home blood pressure cuff so that your doctor can check your home cuff against the cuff that we have in the office to make sure that it's accurate, because sometimes home blood pressure cuffs are not the most accurate. I've done some segments on that. So you can check your blood pressure at home. Or maybe you've gone to other specialists, other doctors' offices, and your blood pressure was low, okay? You might be wondering how low is too low. Well, too low is going to be different for different people. I mean, some people need to have a blood pressure that's lower than 140/90. Some people lower than 130/80. But when people develop symptoms, I mean, yeah, 90/60 is low. 80 is definitely way low. Even 100s over 60 or 70 is low for a number of people. So I'm not here to give you a hard and fast number. If you experience symptoms at a certain point, that is a reason to talk to your doctor, okay? So I'm trying to avoid and sort of skirt around giving you a hard and fast number to look for, because everybody really is different, and this is where you have to talk to your doctor. So back to the point, and when we talk about blood pressure medications being too strong. Now this other side, which I think a lot of my patients, when they tell me, hey, Dr. Jen, I'm wondering if my blood pressure medications are too strong, I think a lot of my patients are actually saying to me, and I'll ask them, I think they're saying, hey, I think I feel symptoms, I feel side effects. Are the medicines too strong? So let's talk about the side effect thing, okay? This is the other side of it. First of all, there are potential side effects to pretty much any and all medications, okay? Even if you go over the counter and you pick up a cream for a rash or a medication for pain over the counter, even the safest medications have potential side effects. So that is something that shouldn't scare you on the outset, that there could be side effects to medications for blood pressure or others. Don't let that scare you, because Tylenol, acetaminophen, ibuprofen, Motrin, anything really over the counter, pretty much anything can have side effects depending on the person, okay? So this is the thing. We also have to keep in mind that there are many different classes of blood pressure medications, thank goodness, and many different types of blood pressure medications can cause certain side effects that we know, or that are well known, right? There is a class of medications for blood pressure that can cause a dry cough. And if I start my patients on that class of medication, I tend to warn them, hey, some people get a dry cough with this. If you do, let me know. Some people on another class of medications for blood pressure may get swelling, like in the legs and the feet usually. And I have to say, hey, we're starting this medicine for your blood pressure. I think it's the best medicine for you, but this is a potential side effect. Other medications can cause fatigue for blood pressure. Some medications for blood pressure can cause sexual dysfunction. There are other potential side effects. So, and remember, this is not much different than anything else, okay? So don't let this scare you. Don't let this scare you off and say, oh, there could be side effects, I don't want to take it. Well, no, that's not the way it goes. There's side effects to anything, from birth control pills to Advil to, you just have to know and be informed about what they could be, communicate with your doctor, and work out a plan, okay? The most important thing is that whatever you're doing is best for your overall health, all right? So if you feel, or if you're wondering that your medications, your blood pressure medications are too strong because you're having side effects, well, you got to talk to your doctor about that. And I would argue that it's not necessarily an issue of the medicines being too strong. Maybe it's simply a matter of you having side effects, that you're experiencing some of the things that I mentioned or other things. What I would say to that is, that's okay. You wouldn't be the only one, meaning, and my point being is, don't feel like, oh my gosh, because these things do happen. Which is why I think it's always important to have this open line of communication with your doctor. If you feel like you're having a side effect that's not life-threatening, that's not urgent or emergent, which would require you to go to the ER if that happens, give your doctor a call. Before you stop the medication, call your doctor, talk to your doctor, or see your doctor about what's going on. If there's something, like I said, urgent or life-threatening, you go to the ER, okay? But don't stop your medications before you talk to your doctor, because sometimes stopping medications abruptly or just stopping them, period, could have really bad effects or side effects for you, okay? But if you're feeling side effects from the medication you're taking, what I would say is that's probably more an issue of side effects as opposed to strength of the medication or how strong it is, okay? And that is something that theoretically could be changed in many situations. There's so many different blood pressure medications, which is great. Oftentimes we can change to another class. We can change the dose if we need to change the dose. We can do a lot of different things. So don't let that sort of deter you or make you feel kind of, make you feel like there's no hope. I'd like you to write in the comments how many of you are on blood pressure medications. Have you ever wondered if your blood pressure medication was too strong? And if you wondered if it was too strong, what made you wonder if it was too strong? Like when we use the language too strong, what made you feel that way or wonder? Understand that the phrase, is my blood pressure medication too strong, is really, in my opinion, sort of a general blanket term for a couple of things. Number one, is the blood pressure medication I'm taking too high of a dose, which is causing my blood pressure to go too low? Or number two, am I having side effects from the blood pressure medication that I'm taking, okay? There are probably other potential possibilities, but those are the two sort of buckets that I'm thinking about. Either one or others really should prompt you to speak to your doctor. So let me know, guys, if this was helpful. Please subscribe to my channel and click the little bell for updates. And I have subscription groups on both with exclusive content as well. You guys are awesome. I hope this was helpful, okay? Talk to your doctor. We are your friends. All right, guys, I love y'all. I'll talk to you soon. Bye.